Hello, good morning to everyone. I am Prof.Manavalam working in SNS College of Nursing. Today in this PPT we are going to see about the current issues faced by the nurses during their nursing practice. Earlier we seen the trends whatever used by the nurses in their practice. However, the nurses they are adapting the changing trends into the nursing practice. Same time they are facing the too many issues for application of the technology into practices. Apart from that, some other issues also adding fuel into that, so it causes overall stress to the nurses that end up with leaving the job and facing the financial crisis. So today we are going to briefly seeing about the what are the current issues that is evolving in the nursing practice. It is issues, it is like trends, it is most pressing issues in nursing today. It is including the nursing shortages, mental health problems, the introduction of technology into the nursing practice, and the ongoing effect of the pandemic disease, especially the COVID. But at the same time, however, we are giving more importance to introducing the trends into the nursing practice. Everyone understand the issues and they have to take the step to improving the nursing profession in order to ensure the high quality patient care. The first one is nursing shortage. This is the major problem everywhere in and around the world. The reasons are, first one is the aging workforce. In nursing, the aging population has increased. More of them they are reaching the retirement age. They are ready to leave the job. Because of this, we are losing the many experienced staff nursing person. Next, high turnover rates. Everywhere they are, because of shortage of nurses, everywhere they are advertising, every hospital they are advertising, they are hiring the personnel with the high benefits. So after seeing this high benefits, every nurses they are ready to move from one places to another places for their betterment. Because of this, the quality of nursing care has decreased, increasing the demand. So, because of pandemic illness, chronic diseases, aging population, demand of nursing services which will be getting increased, but we are not having that many number of nurses in our hand to meet that needs. These reason leads to shortage of nurses. Increasing the workloads, yes, definitely long hour of workloads, and also they are frequently changing their shift. Because of this, their day-to-day life activities getting disturbed, that end up with burnout. Decreased job satisfaction. Because of shortage of nurses, some of the nurses they are remaining in the hospital for a long period of time and they are delivering their services, but it is not effective because they are not having the quality of time to spend with the each patient and having the good communication. Because of these reason, they are feeling unhappy, they are ready to leave their job. Second one is burnout. So burnout means it is nothing but it is an emotional, physical and mental exhaustion because of overworking or because of too much exposing too much of stress. So nurses also, because of shortage of nurses or introduction of technology into the nursing practice without any training, they are also having the burnout. They are experiencing the burnout. Certain symptoms of nurses burnout. First one is emotional exhaustion. They are having the feeling of always depressed, loneliness. They are not satisfied. They are not having the feeling of satisfaction. There is one type of emotional exhaustion. Next, depersonalization. So they are detaching with the patient because of increasing workloads and documentation, and they are participating in induction or training programs in order to update themselves. Because of these reason, they are themselves they are detaching with the patient. They are having the feeling of dissatisfaction. Reduced personal accomplishment, because they are having too many activities to do and they are having too many activities in the to-do list. Because of this, they may have the confusion. Because of confusion, they are not ready to deliver the services in a effective and efficient way. At end of that, they are having the feeling of less accomplishment of their personal as well as professional. So these are all the certain symptoms of burnout. Next, what are the issues they are facing in education and training? Because of introduction of newer technology and changing the healthcare demands, we have to modify our method of education and training to the staff nurses. For this, we need the resources, but we are not having that much resources in our hand to educate and train in a proper way according to the needing demands. So this becoming as a issue for everyone, for both educational institution as well as hospital. So for this, first we have to identify the healthcare demands, the newer demands. Introduction of AI into the healthcare sectors, it is one of the demand, and also culturally diverse the care, that is also one of the demands. We have to critically ill oncology care. These are all the certain examples of demands. We have to identify these healthcare demands and develop the educational program or prescribed or describe the syllabus according to this. So nowadays the INC is readily they prepare the syllabus according to meet the changing demands. They are ready and they are providing the hands-on training experience by simulated with the help of simulated lab. So every institution or universities, they have to develop the educational program according to the changing healthcare demands. Not only develop the program, they have to implement the training, hands-on training by using the simulation lab. After that, evaluate the effectiveness of simulated learning, and they always update their programs according to the changing trends. Next, what are the risks encountered by the nurses in the workplace? First one is the musculoskeletal injury, because they are always involving in the shifting and changing over the position of the patient. Because of this, they are facing the physical strain that end up with a spinal cord injury, varicose vein, because of long standing working hours. These are all some common problems they are encountering physically during the time of their working. Next, exposure to infectious disease. So they are readily contracting the infectious disease whenever they are working in the infectious ward or critically ill wards. They are exposing to the infectious disease. This is a health risk to them. Needle stick injury. So they are accidentally exposing to the needles. If they are accidentally encounter with the needle stick injury, means they are more prone to develop bloodborne diseases. Take as an example of hepatitis, HIV, like that. So these are all the risks they are commonly having in the workplaces. Next, workplace violence. So they are both verbally and non-verbally, they are exposing to the violence in the workplace from the patient sides or from the colleagues, from the management sides. These are all the certain risks day-to-day life they are facing in their workplace. So I think I explained certain issues faced by the nurses in the healthcare sectors. Thank you all. We will continue with the remaining issues in the next chapter.